Today, our focus will be on tobacco control. Now, have you done any project and completed it successfully without funding? I'm sure the answer will be no, because every project that you want to do and complete it successfully must require some kind of funding. And this also includes public health and tobacco control. And that is why today on the program, we'll be looking at how to finance tobacco control in Nigeria. What have been the challenges around this, and how can it be resolved? And we're doing this through the eye of an expert who is seated with me right here in the studio. Of course, they have been campaigners for tobacco control in the country over the years. In fact, they are actually instrumental in enacting the National Tobacco Control Act in Nigeria, which is now undergoing review. And so we will be looking at funding in Nigeria, tobacco control, how it is financed, and critical role of the Tobacco Control Fund in achieving public health goal initiatives. And with me is Michael Olaniyan. He is the in-country coordinator campaign for tobacco-free CTFK or CTFK. CTFK, really. All right. Thank you so much for coming on the show.
Thank you for having me.
All right. So when we say tobacco control funding, what exactly are we talking about?
Okay. Thank you. You see, Tobacco Control Fund is a creation of the law. So the National Tobacco Control Act, like you mentioned, that was passed in 2015, has a provision for what is called the Tobacco Control Fund. This is a pool of resources that the government, in recognizing that tobacco control requires a lot of money to prosecute, to implement, and to, to create awareness around it. And so the pool of fund is created so that the Ministry of Health and all the enforcement implementing agencies can tap into those resources for the purpose of carrying out the necessary activities under the Tobacco Control Act.
So that is the structure. How
that's the structure,
really.
Yes, that's
okay, how does the fund get into that Tobacco Control Fund, really? Where do they source the funding from? Is it all about the national budget?
No, it's not all about the national budget. So you see, the Tobacco Control Fund in itself, the law says that the budgetary allocation must go into it. That's the first, perhaps even the biggest one right now, that all budgetary allocations from the federal government must go into the National Tobacco Control, the Tobacco Control Fund, rather. And then gifts and voluntary donations from persons that do not have any relationship with the tobacco industry. And I will explain why that qualification is there in a minute. But that's one way to get money into the fund. Gifts and voluntary donations, penalties from violations of the National Tobacco Control Act also goes into the Tobacco Control Fund. License fees from manufacturers, distributors, and importers of tobacco products, the license fees collected from them should also go into the Tobacco Control Fund. Now, when you take all of this together, it's constitutes a bit of funding that the Ministry of Health and all the implementing agencies can then begin to tap into. Another source of funding would be, donor funds. So, for instance, if the Ministry of Health or any other agency is able to approach a donor agency and say, oh, we need support to do this, the money would not go directly to the TCU, that's the Tobacco Control Unit, or to the National Tobacco Control Committee. It goes into the fund, and then it is from that fund that expenditure can happen for accountability and all the rest of the probity audit and the rest. Yeah.
Okay, so I do know that you said it's a creation of the law, the Act, really, National Tobacco Control Act, and now that particular law is undergoing review. Let's look at some aspect of the law in the review that is happening now that actually speaks to Tobacco Control Fund.
I'm going to talk about, there are actually 3 bills, strangely. There are 3 bills at the National Assembly.
What they precisely call the 45 and 1151.
47, yes. There are 3 of them. One is still at just past first reading, so it has not gotten to public hearing. 2 of them has already gone through the public hearing. What is even more curious to me is why suddenly we have 3 bills trying to amend one law.
One law.
It's strange,
right?
But we are in an environment where strange things are the order of the day. But even more curious is the fact that one of the bills does not even speak to the Act itself. So it's a different title completely, saying the Smoking Regulation Bill. And there is no law. It says it seeks to amend the National Smoking Regulation Law. There is no law like that in Nigeria, as far as I know, and I've taken my time to go through the body of laws in Nigeria. There is no such law. You know,
You are a lawyer, by the way.
Yeah, I am a lawyer.
I understand. Yeah, I didn't remember to tell your viewers that. Okay, so go ahead.
So I'm a lawyer, so it's my duty to check this kind of things before I make statements on them. And there's no such law in existence in Nigeria. So if at the most elementary basic stage, which is to link the bill to the correct law, if you are not able to do that, then it makes your intention for reviewing that law really suspect. And as if that is not enough, there is also the part that, you know, the bill, the sections that the bill is referencing and says, oh, we want to amend section this, which speaks to so clause, so provision. It doesn't tally with the law that is seeking to amend. So it's like saying, oh, section 1 that speaks to, say, funding, for instance. You know, and then you go to the Extant Act, and then you find that funding is actually in maybe section 5. You know, it just shows that it was hastily put together. Intentions as of today are not so clear, but like my colleagues would say, it's a non-starter. It's not something that we should even be discussing. The second bill, which is the more substantive one, is the HB 47. That's the one introduced by Honorable Pascal Agbondike, which, in my opinion, is a good step in the right direction. So the bill was carefully put together, but that's not to say it's a perfect review. Of course, there's room for improvement. We've reached out to the honorable member. We've also reached out to all the stakeholders that we think should have a role to play in this, and we are looking at how we can strengthen, we can support, you know, to be able to ensure that what the review is actually a positive one and doesn't weaken the structure of what we currently have. Some of the things that Honorable Pascal Agbondike is trying to introduce is to expand the places where you cannot smoke. So it recognizes that places around children care, daycare, schools, you know, it's not sufficient to just say, oh, you cannot smoke in daycare. It's also saying that 30 meters away from daycare centers, you cannot smoke there, which is a laudable improvement
on the existing law.
On the existing law. You understand? So when we talk about strengthening it, we're not saying bring new provisions, absolutely. We are saying don't make a review that will weaken what we currently have, because what we have currently is not even as strong as we want it to be. So we shouldn't be going backwards, we should be going forward. You know, it also says that the Honorable, through the bill, is also trying to ensure that there is sufficient provision for money to go into the National Tobacco Control Fund.
So it's part of the HB 45 you're talking about?
Yes, it's 47, yes. It's part of the HB 47. So it's saying 40% of tobacco taxes should also go into the fund. You know, that's a laudable idea because, like we all know, budgetary allocation is subject to political whims and caprices. The president or whoever is responsible for allocating funds might decide and say, oh, public health is not a priority for now, I want to focus on something else. But the disease burden that tobacco use and exposure places on the health system, on the economic system, on our social life is constant. It's always there. In fact, it gets worse every time. So we should have a consistent, reliable, predictable source of revenue to go into the Tobacco Control Fund. That way, we would always have some fund through the government to be able to do what needs to be done to protect our people.
That brings me to asking, really, because I know this law has been in existence since 2015 when it was passed into an act of parliament, and then one would wonder, you know, how much effort has has been put with this tobacco fund? Has it actually yielded desired result?
Yes, absolutely. It has yielded desired
Because I remember for several years, you were talking about operationalization of the tobacco fund. That took years to come into existence.
It did. And I'll tell you why it took so long before we could operationalize the fund. And when I say we, I mean as a country, Nigeria, because it's when it comes to funding, when it comes to implementation, it's the role of the government. But the government also is acting for us as the people. So when I say we, I mean as Nigerians. It took Nigeria so long to operationalize the fund because there were a lot of gray areas around how the fund will be situated within the TSA. So there is a structure that says all monies must go into one pool for the federal government. So how do you then ensure that from the TSA it flows into the fund? Navigating that conundrum was a bit of a challenge, but the Ministry of Health was able to get that right. And now the fund is operational. Fund monies have been going into it. Have they been able to use the money? Well, I'm not...
For effective tobacco control,
For effective, yeah, exactly. Yes. So have they been able to use the money from it? I would not be able to answer because I don't have that data. I don't have that information. But what I do know is that they have been able, the Ministry of Health and other implementing partners, or implementing agencies, have been able to implement tobacco control efforts across the country. So there are jingles going, particularly in the rural areas, to educate people on the dangers of use and exposure to tobacco. Whether that money is coming from the Tobacco Control Fund, I cannot tell. But one thing I do know is that the government, through the Ministry of Health, has been able to do that. And so that is one major win. So we have more awareness, even at the grassroots level. There's been a lot of capacity building for law enforcement agencies.
Okay, when it comes to funds like this, one of the major issues is accountability and transparency in the management and disbursement of the funds. So I wouldn't know how you have been able to look at this and whether there are mechanisms in place to monitor, ensure that this fund, even when there's more pool of fund, is being transparent and, allocated wisely for tobacco control and not diverted.
Yeah, not diverted. That's the key word there. Okay, so there are several measures. The law as it is today says that the fund is to be managed by what is known as the National Tobacco Control Committee, NATOC. Now, NATOC is comprised of representatives of different government agencies, ministries. Ministry of Environment is there, Agriculture, Ministry of Health, the Federal Competition and Consumer Protection Commission, Standards Organization of Nigeria, NAFDAC. It's a large committee with representatives from all the key stakeholders and civil society. That is one layer of accountability because the fund is to be managed by them. So they have oversight over it. That is not to say that, because we now have that, automatically it's going to be free from mismanagement. So there is the second layer, which is the Minister of Health is responsible. Now, that fund is not a fund that the committee or the ministry would expend without process. So there is the Ministry of Finance who continues to have oversight over all monies that belong to the federal government, by the way. And then there's the Office of the Auditor General, which are like statutory offices that govern those issues. Now, one of the things that we are recommending in this review process is to introduce another layer, which is a situation where an independent body comprising of stakeholders, health stakeholders, and civil society and the ministries that are responsible will then jointly still look at it to ensure that, one, there must be a budgeting process. So it's not just that, we have so much money and then we just continue to spend. What is your plan for the year? And then whatever it is that you have done for the year must tally with what your budget is. Of course, we recognize that there are instances where you may need to respond quickly, to reality, so things that are happening. There must be due process, there must be an approval process to ensure that monies are not being collected and just being wasted on other things. Part of the recommendations in the review process that we have put forward to the National Assembly is to ensure that there is accountability of some sorts, so that when those monies are being collected, it is ring-fenced. It's such that it's earmarked for just tobacco control measures, not something that you can say, we have so much money in tobacco control, but because we need to spend money on, say, logistics or flight, and then we go take money from that. No, it's completely, going to be ring-fenced so that such things. Another recommendation that we have made is to ensure that administrative, logistical issues around tobacco control do not constitute more than 20% of the fund at any time. So anything you're spending for the year must not be more than 20% for logistics. The remaining 80% of whatever you're spending must go into the enforcement and implementation itself. That way, it helps to prevent a situation where you start buying cars or flying private jets up and down,
Okay, these are suggestions, but whether they will be factored in is another thing while the debate goes on with the new bill. Okay, so let's look at the appropriate role or the role that appropriate taxes really play in actually garnering up, money for this tobacco control fund.
So taxation is one of the cheapest and most effective ways of reducing consumption of tobacco products. And the example is all around us. You and I will probably know some families that maybe when they were going out some years back would go with two cars. The husband would go one car, the wife would go one car in the same direction. But now, with the realities of subsidy is gone, right? We are more economical. And that is even on the most essential things like fuel, When When you take that to tobacco consumption, one, tobacco is not food. So it's not an essential commodity. When you raise tax on tobacco, what happens is that it takes it beyond the reach of the poor and children particularly. So when you raise the tobacco tax and it becomes expensive, because the key desired effect of raising tobacco tax is to raise price. When you raise prices, children then cannot afford it. That's the goal. When children are unable to afford it, it reduces initiation. Research has shown that if you do not start smoking before the age of 21, you are very unlikely to smoke. You cannot teach an old dog new tricks. And that's why the industry targets children, targets young people. And also, that's why we also need to ensure that our economic strategies, our marketing strategies that we are putting in place are also targeting young people to ensure that they do not start the habit. Now, when you raise taxes, prices go up, children do not start. Even the people who ordinarily were already consumers of tobacco products before, for the economic realities, we begin to consider quitting. Right. Now, that is one aspect of it. Consumption drops. The second benefit is that it raises revenue for the government. Then the government is able to take this new inflow of money from increased tobacco tax and then plug it into essential public health needs, such as the tobacco control fund that we have discussed. So it's a win-win situation, you know. Let me also say that Nigeria is perhaps one of the cheapest places, or one of the places to get the cheapest tobacco products in the world. So there are people who come to Nigeria from other parts of the world, and then when they are going back, their colleagues, their friends in places we call Sena climes would say to them, get me packs of tobacco.
Because it's cheaper.
Because it's extremely cheap. And all of these companies that produce tobacco products in the world are not even, the majority of them are from those Sena climes, so to say, where it's very expensive. So what they have been able to do is they understand that when the price is low, initiation is high. When you start, the day you start smoking is the only day you can tell. You cannot predict when you will stop. It's that addictive. And so we need to ensure that people are unable to start
at all.
And that is the essence of increased tax.
Okay, so before we let you go, as someone who is deeply involved in tobacco control, I've known you for years, and I know this is all you've been doing all the years we've known you. So what are your parting words as advice to policymakers, tobacco control, advocates like yourself, and even individuals in Nigeria in terms of how to, move forward tobacco control fund to ensure that, it helps in public health issues we're talking about in the country?
Two keywords for policymakers. First is, for every review, for every attempt to improve on the law, because I believe that the lawmakers who are presenting these bills want to improve on the law, there must be conversations not just with the industry. There must be conversations with stakeholders, with health experts, with civil society experts who have been working on tobacco control for years. And I'm not saying talk to me. I'm saying talk to my colleagues. Talk to the people that have been on the field on tobacco control for so long. We have so much to share. We've reached out to them. That's one. The second is invest. We need the government to begin to invest in data. And when we say invest, we're not talking about some esoteric research work. We're saying in the regular day-to-day health data that's collected in our hospitals, can we begin to include data around, do you smoke? Are you exposed to tobacco? Then we can begin to use all of those data. When did you start using tobacco products? All of those data are important to help in our policy making. Those are my words to policymakers. I don't want to elaborate so much on that because of time. The second class of people that I will talk to are my colleagues who are advocates, is to say that there's always a temptation to look at where we are and say, oh, we have not gotten to where we are going. But the truth of the matter is that we have come so far from where we started. In 2005, when this journey for a tobacco-free country started, we had advertisements all over the place. So we've seen countries that moved from like 40% prevalence to single-digit prevalence. It shows that the strategies that are being applied globally, which are also being recommended in Nigeria, are strategies that do work. And I believe that someday, somehow, we will get there.
someday, somehow, we will get there. Parting words from my guest this morning on Tobacco Control Fund in the country. Michael Olaniyan is the in-country coordinator campaign for tobacco-free kids. I don't know why I'm mixing this up. Or CTFK, the campaign for tobacco-free kids. Okay, yeah. So thank you so much, Michael, for your time with us on this one. That's been Environment today on Africa Independent Television. Thank you for being a part of it. My name is Nkoli Omod. We'll be back again next week, same time on this same station with a fresh package. Until then, please remember that environment is life. So do your bit, I'll do mine, so we can preserve it. From everyone on the Environment Today crew, we wish you the very best. Bye for now.